Hello and welcome to Health Dialogue Show. I'm Dr. Bhumika. So, as we all know that 14th of November is marked as World Diabetes Day. And therefore, today's show is dedicated to diabetes, which is a global health concern. Diabetes affects eye health by damaging the retina's small blood vessels, leading to conditions known as diabetic eye diseases. High blood sugar can cause these vessels to swell, leak, or become blocked, with diabetic retinopathy being the most common result. This condition can lead to vision loss or blindness if not addressed. Diabetes also raises the risk of diabetic macular edema, cataracts, and glaucoma. Since symptoms may not appear early on, regular eye exams are essential for those with diabetes to catch and manage these issues promptly. So, to address a few questions linked to eye health in diabetes, we have Dr. Santosh Bhide here with us today. Dr. Santosh Bhide is a seasoned ophthalmologist with over 25 years of experience in diagnosing and treating a wide range of eye conditions. Based at Ruby Hall Clinic in Pune, he is known for his expertise in comprehensive eye care, from routine eye exams to managing complex ocular diseases. Dr. Bhide's commitment to patient care and his proficiency in the latest ophthalmic techniques have made him a trusted specialist in his field. We welcome you, sir. It's a pleasure to have you on board with us today.
Good afternoon. Thanks for kind introduction, Dr. Bhumika. I am
Yes.
In practice for last 33 years. Thanks for the kind introduction. Yeah.
Thank you, sir. So, it's a pleasure to have you here, sir. Let's talk about eye health and diabetes.
Sure.
So, my first question to you is, how does diabetes increase the risk of eye conditions, and what specific eye diseases are commonly associated with it? Can you elaborate a bit about?
Sure. Actually, as we know that because of our change in lifestyle, diabetes is now in a big way in India. In fact, India has become a hub for diabetes. In fact, every fourth Indian is at risk of developing diabetes. And those who have diabetes, they are also at the risk of developing diabetic retinopathy. But diabetes does affect eye in different ways also. Basically, diabetes is a disease of microvessels. Means because of high blood sugar, it affects the endothelium of the blood vessels. Because of the defective mechanism of the endothelial cells of the blood vessels, there is increased permeability of these blood vessels, which leads to leakage of fluid from the blood vessels. And this leakage of fluid leads to exudation or deposition of lipids in the layers of retina, or it does cause swelling in the retina. And because of all these things, the vision is reduced. Because of increased leakage, there is decreased blood supply or decreased oxygen supply to the retina. And since the oxygen is reduced to the retina, there is a tendency of formation of new vessels. And when the new vessels are formed, these new vessels are basically the endothelial cells, and the wall of these new vessels is very weak. So they have a tendency to bleed. And because of this, there is bleeding in the retina. And in the later stage, what we call as proliferative diabetic retinopathy, there can be bleeding in the vitreous also, which leads to vitreous hemorrhage. So in this way, diabetes can affect eye. But in the initial stages of diabetes also, we do get some problems in the eye. The most common problem is frequent change of refractive error. That means a patient comes to us and he says that my number is changing frequently, doctor. What should I do? If you find such patient, ideally you should ask him to get his blood sugar checked. And in most of the cases, we find that in such patients, the blood sugar is always on the higher side. So this is the first symptom of the patient who is not known diabetic, but he comes for routine eye checkup and says that my number is changing frequently. Second thing is that those patients of diabetes, they are also at high risk of developing cataract at the earlier stage. As we know that cataract is a disease of old age, but in diabetics, this can happen at the earlier age also. And if your blood sugar is not under control or the blood sugar control is not proper, that leads to swelling in the lens, natural crystalline lens of our eye. There is diffusion of fluid. This leads to denaturation of the proteins which are there in the lens, human lens, crystalline lens, and that leads to early development of cataract.
So my next question to you is, what are the early symptoms of diabetic eye disease and how can patients recognize these symptoms?
The early symptoms from the patient's point of view, a patient will come for routine checkup, but we give him the number for specs, and after few days or few months, he will come immediately say that my number has changed. So earliest thing is that frequent change in the refractive error, that is the earliest change. From patient's point of view, patient will start seeing blurred vision. That is the most common thing, and that visual quality in the day, in the morning it is different, in the afternoon and evening also it differs as per his blood sugar levels. When his blood sugars are on the higher side, there is a myopic shift and patient gets a blurry vision because of myopic shift in diabetic patients.
So my next question to you is, how does high blood sugar directly impact the blood vessels in the retina? And why is this concerning for vision health?
The high blood sugar, actually, as I have mentioned, there is a in the retina is supplied by blood vessels, and for retina to function we need oxygen, and that oxygen is retina is getting from blood vessels. Now these vessels are micro vessels. Now all blood vessels have a particular structure, and in that structure the innermost part of the blood vessels is uh, covered with a single cellular layer which is called as endothelial cells. So endothelial cells of the blood vessels, they have, for their survival they need oxygen also, and they also need glucose for energy. So in diabetic patients there is a high blood sugar level, so the glucose metabolism in the endothelium of the blood vessel gets affected. The blood sugar concentration in the endothelium of the blood vessel becomes high, and because of this deranged mechanism of glucose mechanism in the endothelial cells of the blood vessels, they get damaged, and endothelial cells are required for preventing blood from extravasating out of the blood vessels. So once the endothelial cells are damaged, there is extravasation of blood from the blood vessels in the retina, and that leads to swelling of the retina and affection of the retina in diabetic patients.
Yes, sir. All right, sir. My next question to you is, what is diabetic retinopathy and how is it different from other diabetes related issues?
Diabetic related issues in the eye, I have mentioned there are various effects of diabetes on the eye, like change in refractive error, development of cataract, development of glaucoma, and diabetic retinopathy. Now, retina is a structure of eye because of which we all see everything. The world is seen because of the retina. Retina is like a film of the camera. So, because of diabetes, there are diabetic retinopathy is in we have as a medically we divide diabetic retinopathy into non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. In early stages of diabetes, or those who have diabetes for less duration, in such patients we do find non-proliferative diabetic retinopathy. In that case, the changes in the retina are minimal. Most of the time patient comes to us, a diabetic patient comes to us without any visual complaint, but such patients also should examine their eyes. The need is because most of the times they are not aware that their retina is getting affected because of diabetes. Unless and until we put drops in the eye, dilate the pupil and examine the retina properly, we won't find that patient is having diabetic retinopathy in non-proliferative stage. If a person is having diabetes for longer duration, say for more than 5 years or for more than 10 years, then the risk of developing proliferative diabetic retinopathy increases. I have already mentioned previously how there is extravasation of blood in the retina which leads to swelling. Now in the retina, there is a most sensitive part called as macula. So with this macula, we see everything. The whole world is seen with fovea and macula. So if there is a fluid which gets accumulated in this macula, there is a formation of cystoid macular edema, and because of this cystoid macular edema, the vision of the patient again gets reduced in diabetic patients. So in diabetics there are various stages of retinopathy: non-proliferative and proliferative retinopathy. There is also a diabetic maculopathy. There is a diabetic macular edema. So, unless and until a diabetic patient undergoes a thorough ocular examination, a doctor won't be able to tell him whether you are having retinopathy or not. So, in diabetic patients should get their eyes checked frequently.
All right, sir. So you're mentioning about getting screened regularly. So how frequent should be these screenings done? And also, I would like to know that if you can highlight a few screening methods that are usually undertaken by the physicians.
Those who are having diabetic, those who are recently detected diabetes, if you are detected diabetes, immediately you should go to ophthalmologist and get your eyes checked. A thorough checkup which involves checking your vision, checking your refractive error, checking your intraocular pressure, the anterior segment examination by slit lamp examination. We also examine the retina under mydriasis. That means we put drops in the eye, dilate pupil, and entire retina is seen. And if we find that there are some changes in the retina, then there are advanced tests also. Like there is a test called as OCT, or optical coherence tomography. Optical coherence tomography is a machine which actually visualizes the different layers of retina. Now there are 10 layers of retina. So all the layers can be seen by OCT. And if we do OCT of a diabetic patient, then we come to know whether the patient is having any diabetic macular edema or not. So in some patients we do advise angiography also. So like in angiography we give injection in the vein and we take photographs of the retina. How angiography of the heart is done, similarly the angiography of the retina is also done to find out leakages, to find out neovascular tufts whether they are there. But these procedures, there is an advanced OCT also, what we call as OCT angiography, in which there is no need to give injection in the vein and take photographs, but this with this machine we also come to know the architecture of the blood vessels in the retina. So these are different tests. So now, should a patient who is recently diagnosed, should he undergo all such tests immediately? The answer will be no. He should first undergo a thorough, comprehensive eye checkup, which includes checkup of visual acuity, refractive error, intraocular pressure, and retina or fundus examination. If a patient is having diabetic retinopathy, which is a mild non-proliferative diabetic retinopathy, then ideally such patient should undergo his eye checkup every 6 months. If that is not possible, at least once in a year. If patient is having a proliferative diabetic retinopathy, such patients should undergo eye checkup every 3 months. So for a diabetic patient, routine diabetic patient, every yearly. Those who don't have any diabetic retinopathy, a non-diabetic patient without any diabetic retinopathy, every yearly checkup. A non-diabetic patient with mild non-proliferative diabetic retinopathy, at least every 6 months. If that is not possible, once in a year at least. Those who are having proliferative changes in the retina, they should get their eyes checked every 3 months. These are the frequencies, and there are various ways, and there are some advanced techniques like optical coherence tomography or OCT angiography, or retinal angiography. These are the different methods.
All right, sir. That's an important piece of information. So my last question to you is: can lifestyle changes and better blood sugar management, which is obvious but important in slowing the progression of diabetes-related eye complications?
As we know that diabetes is a very complex disease. It is not only related to your diet, It has multiple facets. Those who are genetically predisposed for diabetes, they do develop diabetes at the earlier age. Those who are genetically predisposed for diabetic retinopathy, they develop diabetic retinopathy in the earlier stage also. The third factor is that nutrition also is very important. Those who do not follow guidelines, those patients who are at the risk of diabetes, and if they don't follow dietary guidelines, their blood sugar will not be under control. And if your blood sugar is not under control, then you are definitely at the high risk of developing diabetic complications or diabetic retinopathy. Another important point which I would like to mention is that those diabetics who have diabetic retinopathy, they have diabetic nephropathy also. Eye, as we call that, eye is a window of our heart, or eye is a window of our health. Eye is the only structure in which we actually visualize blood vessels. And when we visualize blood vessels and when we see that there are changes in these micro vessels, in the body there are micro vessels everywhere. All the organs like heart, kidney, brain, they are also having micro vessel blood supply. So everywhere diabetes has affected. So try to understand that, don't take diabetes very casually. Get your eyes checked early so that the changes in the blood vessels are detected at the early stage, and then definitely some preventive measures can be taken to prevent further damage, not only to the eyes but to kidneys, to the heart and other organs also.
Thank you so much for speaking to us today, sir. It was a pleasure to have you here. Thank you so much.
Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.